Hello, my name is Josh Allen, and I'm an adult gerontology acute care doctor of nursing practice student at Emory University in Atlanta, Georgia. I'd like to take a few minutes to briefly summarize the events that inspired me to become an adult gerontology acute care nurse practitioner, or AG-ACNP. I'm a registered nurse. I've been an RN for 6.5 years, the last 2.5 of which I've spent practicing with Emory Healthcare. I practice in the medical intensive care unit at Emory University Hospital Midtown, as well as the serious communicable disease unit at Emory University Hospital. It was actually the latter role that brought me here to Atlanta back in June of 2016. As background, I'd had a lifelong interest in emerging infectious disease and public health preparedness. So in 2014, I volunteered to travel to Liberia to participate in the international humanitarian response to the West African Ebola virus disease epidemic of 2014 to 2016. While I was able to obtain NGO sponsorship to travel to Liberia, unfortunately I was unable to obtain the time off necessary to travel, provide patient care, and then be quarantined for 21 days upon my return. So unfortunately, while I was unable to participate in that response, I did resolve that I wanted to work in a national biocontainment unit, and since Emory University Hospital was among the leading international centers for biocontainment patient care, I chose to come down here. In contemplating the outcomes for the 11 patients that were fortunate enough to be managed in intensive care units in North America and Europe, of whom only 2 succumbed to their illness for a case fatality ratio of 18% versus the over 28,000 patients that were managed in West Africa, of whom over 13,000 succumbed to their illness for a case fatality ratio of 39.5%, I speculated that access to appropriate critical care was likely a key determinant of mortality in Ebola and other high consequence infectious diseases. So that got me wondering, is there a way that we could bring critical care resources outside of the 4 walls of a fixed tertiary care setting and into austere and medically underserved environments when they're needed the most? And ultimately, could this be applied on a mass casualties scale in the event of a pandemic or other complex humanitarian emergency? I quickly realized that in order to maximize my personal potential to offer the maximal mortality benefit to large swaths of the population, I needed to become a healthcare provider, a physician assistant, or nurse practitioner. I chose the latter path because an NP program essentially picks up where my undergraduate nursing training left off to afford me advanced clinical knowledge necessary to medically manage a specific population. In the case of the AG-ACNP Adult Gerontology Acute Care NP specialty, this would be adults age 13 or greater with complex, potentially life-threatening disease processes. This would include, in terms of medical management, this would include ordering and interpreting diagnostic studies such as radiographs, laboratory assays, or EKGs, as well as performing complex and potentially life-saving procedures such as intubation, central line placement, or cardiac defibrillation, to name a few. AG-ACNPs can be found practicing in intensive care units, emergency departments, operating rooms, advanced specialty clinics, medical surgical wards, critical care transport platforms, disaster medical assistance teams, academia, and even the federal government. I personally hope to split my time between clinical critical care and infectious disease practice in an academic medical center, as well as population-level disease surveillance and outbreak investigation for the Centers for Disease Control and Prevention. But there are really limitless opportunities in this NP specialty. So if you're someone who hopes to apply advanced knowledge to make a decisive impact in the life of an adult, I would highly encourage you to consider pursuing a career as an adult gerontology acute care nurse practitioner. Thank you very much.